Hello and welcome to Policy Bazaar. I'm Arjun Bhagat. Now, prevention is better than cure, especially if you get a tax break for it. Preventive health checkups may have been around for a while, but the tax exemption for them is a recent development. Most hospitals and clinics offer health checkup packages. Now, this includes the vital medical parameters and also pathology tests. But do we really understand what preventive health care is all about? Now, to talk more about these plans and why it is important in detail, we have today with us Yashish Dhaya, CEO of Policy Bazaar and also its founder. And along with him, we have Visham Sikand, founder and chairman of the Indian Health Organization. Welcome to the show. Welcome to Policy Bazaar. Visham, first question to you. What is preventive health checkup and why is it so important?
It's a fun word, actually. I'll say it. It's more about your day-to-day healthcare. And today, for example, 10 years ago, people didn't want to go to a gym. Today, everybody wants to probably go to a gym because they want to feel healthy, live a better life. So preventive healthcare, which everybody knows, is taking care of your day-to-day healthcare. How about what if I tell you that you can go to a dentist and get your treatments done at lesser cost? If you can go to a doctor and get your things done at the right time? Till yesterday, a health checkup would have been costing you around 5,000 rupees. With so many players coming in, this could cost you lesser than 4,000, 3,000 rupees. And it's more focused on your day-to-day healthcare. So it's leading a better life on your day-to-day basis. Yeah.
Now, Visham, tell me, more tests doesn't really mean a healthier you, does it? And also, what about the impact of technology in these preventive health? What do they really do? What are some of the signals that they may give so that you end up living a more healthy lifestyle?
Look, a health checkup, as we all basically know, allows you to understand what your basic parameters of your health are. So it's not that if you start doing it every month, you'll get better health. But obviously, if you start coaching yourselves towards those directions, for example, if your cholesterol comes out high and you go to the right cardiologist at the right time, or if you see a sign which is different from what it should be, and you go to the right doctor at the right time, it'll always obviously help you. We being Indians, being a bit lazy on the healthcare, this is what the challenge is. And if somebody is there to induce you, tell you, okay, you can call up a doctor, visit a dentist, as I say, or a cardiologist or an orthopedic at the right time, then this will help you detect diseases at the right time. So obviously, multiple health checks will not help you resolve the issue. You will have to ensure that you go to the right doctor at the right time or take the steps at the right time, so as to ensure that you get back to the right parameters on your healthcare. Technology, yes, there's a lot of technology that's happening. For example, you can talk to a doctor on the phone, you can chat with doctors at the right time. There are companies like ours which help you access the right networks at the right time.
So basically you're saying is prevention is better than cure in that sense. So Yashish, now tell me, there's so many packages that, I mean, one is actually bombarded with these packages these days. You go to a bank, you go to a clinic, they say, all right, why don't you do this? How does a customer or a person actually decide which preventive package to take, preventive health checkup package to take?
Yeah, I think you obviously have the tax break of about 5,000 bucks. So as long as you're getting it within about 5,000 rupees, that makes a lot of sense. I think you've got to see how soon can you get enrolled in this? What are your particular needs and how they can be catered to? So essentially, how soon can you enroll on it? That means when can your preventive tests start? What are the level of discounts you're likely to get? On which activities or which diseases are you more likely to use them? So if you are likely to have a dental problem, then you may, or you already have a dental problem, then such a card gets you discounts on dental treatments. Or if you have, let's say, another sort of problem, then then you look at the discount on that particular activity. So you look at what would you be needing, what are the discounts available. See, these have to be understood. There are two pieces that they give. One is the preventive health checkup, and the second is discounts on various sets of treatments. And so you have to see which ones you're likely to use. So essentially, it's a cost game, but I think it's also how soon do they take you on. I think that's quite important.
What about the difference? Let's clarify the difference between, say, medical insurance plans, health insurance plans, the traditional ones that we take, and the preventive packages that we are talking about here.
So see, they are absolutely dissimilar. They have a very low similarity between them. If you were to think about it, let's talk about a medical insurance plan. A medical insurance covers you once you've been 24 hours in the hospital for certain diseases. So, for example, dental, etc., is not really covered under medical treatment. Many medical policies, medical insurance policies, would not offer a preventive health checkup, although some have started offering that. So, for example, Religare Health does offer a preventive health checkup. So, I would see it as a complement to a base medical plan. Now, so you have your medical plan. On top of that, you do your checkups, which help you. On top of that, you get discounts for those activities which are otherwise not covered within your base health insurance plan. So that's where you. Now, the other way to look at it is also, as you look at older patients, as you look at patients which health insurance would not take on. Now, this particular piece of preventive health has got no restrictions. It will take on older patients, it will take on patients with diseases, it will take on all of those. There are no restrictions to how much you want to use the facilities. So discounts are available as often as you want to utilize them, whereas a base health insurance plan will have certain curtailments of the total cost that you can utilize. So it's entirely different. I think that a time will come when the base health insurance plan will start offering certain discounts if you had the facility of a health card as well, or a preventive health card as well. And that is basically, the preventive health card will reduce your medical costs over a period of time. And hence there is a somewhat a wellness kind of linkage between the two. That's how one would see them.
Vishram, you talked about a tax break, and Yashish also talked about a tax break that one can now include in your income. Talk about that a little bit. And usually a preventive health checkup costs between 3,000 to 5,000 bucks. Now, is that covered under 80D?
So one thing that the government did in a good direction was allowed this kind of a program come under 80D tax benefit, because obviously for the government also, if people are more healthier at the right age, it's much better. So, and you have a 5,000 amount of total amount of 80D benefit that you can take from a product like this in the 80D clause, which was up till yesterday of 15,000 total limit, under which there's a sub limit of 5,000 rupees. So this allows you to focus on your preventive health checkups and also get the 80D tax
What
benefit.
about the family? Is the family, can you add that if you get, say,
this is just
for the individual,
for each taxpayer. So if you have 2 taxpayers in the family, each one of them can take 5,000 rupees.
Now, Vishram, what are some of the features of a preventive health checkup? What are the areas covered? And, how long does it actually take?
Okay, so this is something interesting because it's very less in India right now. Something like this exists in US where you have discount dental plans and all. Over here, broadly, but
a lot of corporates have introduced it for their employees.
Yeah,
I mean, we see a lot
so
of people going.
Earlier, we were doing a lot more of retail of these kind of programs, but now corporates also doing it for their employees. So broadly, you have health checkups as part of it, which is very critical. You have dental cleaning as part of it. You give free dental cleaning to people. You give access to around 1,000 dentists across the country where you can get your treatments at less than 30%, at 30% lesser cost. Doctors at 50% lesser cost. You get laboratories at 30% lesser cost. So and hospitals at 20 to 30% lesser cost. So for example, if you want to visit a Max or a Fortis, you go via a preventive healthcare plan and insurance was not covering you. This allows you to save about 20 to 30% on your treatment. So, and obviously other added technology features like talk to a doctor or chat with a doctor, second opinions, and maybe analysis of your health checks also through a empaneled doctor by us. Yeah.
Yashish, would you like to add something to that?
I think no, that's absolutely it. In terms of who it is most suited for, I think it gets more and more suited for. It's useful for everybody. So everybody should have a preventive health checkup. It just helps you. And I find it very odd that health insurance companies do not have that because they'll eventually reduce their own costs. However, where it gets most suited is where you start getting denied health insurance. So especially at older ages, or that's where it becomes very useful. And especially after 45, when getting a health cover becomes restrictive, this is a very good complement to that, which assists you in all those costs that you want to take. At least brings those down.
Now, Vishram, a lot of people have pre-existing problems or a history of medical problems, and also how does can you actually go and say that, look, these are some of the tests that are important for me? How does that work?
Look, in 40% of the Indian population households have some kind of disease. India is the cancer capital. Sadly, India is heart issues as one of the capital of the world. Diabetes is one of the biggest issues in every second household. So there's no product which allows, for example, if someone in your family has to go for a dialysis every alternate day or something like that, who takes care of this? So it's programs like this which will help you obviously detect this on time and also help you save cost on this. So it's really a good boon for people who have someone in their family who has some pre-existing disease in the family. At least it helps you save costs.
And naturally a very, very important subject, preventive health checkups, and I hope a lot of people take that. But now it's time for a short break. When we come back, we're going to take your questions, but you can also write to us at ask.policybazaar.com or on Facebook/PolicyBazaar India. You can tweet us at @PolicyBazaar_in, and we'll see you shortly after this break. Keep watching.